Starting IV, it's all about preparation and then all about location and choosing that. The actual putting the needle in the vein, anyone can do that with practice, but setting yourself up for success is the best way to succeed. So as you guys can tell, I've already set up all my equipment and I've checked the expiry dates. So I've primed my lock, and that's just with normal saline. That's again just to ensure that there's no blood or no air, in the tubing, so I don't cause an air embolus. And so I push a little bit and I see the saline come out, and it's still aseptic because it's still capped. I have my IV size picked out. I'm going to start an 18 gauge interesting because I've already seen his veins. He's got nice veins. I have a tourniquet, my Tegaderm expiry 2023, and I have a 2x2. And what I do is I open the 2x2 and just have a little piece sticking out so it's easy access whenever I go to grab it. I have my alcohol swabs here and my IV catheter itself, 2021, August 27.
Very specific date.
Yeah, no.
Wow.
This is a bad day for IV.
What a science.
So I prepared all my equipment, set myself up the best way for success. Now I'm going to choose a vein by placing the tourniquet on. Are you okay if I go on your left arm, Tristan? And I consent to do this?
Absolutely.
Okay. So again, I'm going to go just proximal of the AC so that I have best visualization of all the veins proximal or distal to it. In case he, by chance, doesn't have anything appropriate distally, then I can still see the AC. And so I'm going to give a nice tight tourniquet. And it's secured so that I can pull it out if needed. So I'm going to look distally. He's got a nice IV in his hand, and as well a massive one in his AC. So I see two that I like. Now I'm going to start in his hand, and if that doesn't work, then I'll go to the AC. So I know that's kind of like a safety. So I'm already set up, so I can go ahead. I can clean the area, starting from the inside, moving outwards. I look at the alcohol swab, so there's not a lot of dirt, so I know I don't have to do it again. Now I can gather everything's going in the garbage, and I have a sharps container. I take my cap off, sharp out. Again, I manipulate it just slightly to loosen it up. So you're gonna feel a small pinch in your hand here, Tristan, okay?
Okay.
So I'm gonna grab his hand, I'm gonna hold traction again between the knuckles. I'm gonna anchor with one finger, and then I'm gonna go into the vein just above the bifurcation at an angle, 30 degrees or so. So a small pinch, and I'm gonna push forward. So I see flash in the flash chamber now. I'm gonna lower the cannula down to the hand level, push through just past the cannula piece, securing it, and then advance the catheter with my free finger. And it's out, so the needle's no longer in your arm. Keep your arm still, please.
Can I see the chamber quickly too?
Sure.
Just so they can see the visual of how the chamber is full of blood.
Flash chamber there is full of blood.
Perfect.
Take the tourniquet off. So now there's no more blood being stuck in the arm, so the vein's no longer at risk of rupture. Now I keep his arm still. Now to prevent any mess, I take the 2x2 and I stick it under the cannula like that. Okay, so any blood that does come out, now it's gonna stick there. It's not gonna make a mess. I have a free hand like this, so I'm gonna occlude this vein. So what I'm doing right now is I'm gonna stop any blood flow that may come out from the vein when I take off this cap. Because when I take this off, now I'm opening the vein to the air and to the environment, and the blood's gonna flow freely through it. Okay, so if I were just to take this off, for example, and not occlude proximal to it, it would bleed out, just like a vein would if you were to puncture it with anything. So I'm gonna occlude it like this with my finger, putting pressure. I'm gonna hold this down, twist it off, and I'll put this directly in the sharps container. Now I take my, see I have my finger there, there's no blood coming out at all. Okay, take this finger and take off this cap, aseptic still, and I'm gonna connect it to the vein and the catheter. Okay, this goes in the garbage. So now we're connected, we're now a closed system, so I don't have to occlude it anymore because it's not gonna bleed. What I like to do is see any blood there, bled through, and we're okay to put that in the garbage can. So it's no mess. Now to ensure vein placements correctly, you want to flush nice and easy. They should feel a little bit of coolness going up the arm.
I can feel the coolness.
And it should be a nice smooth flush. Should be no resistance, just like you're pressing it into air. And another way to check is you draw back. See a little bit of blood in the chamber. Makes you weak in the eyes, just wiggle your toes.
Can you take a little more out? Just for,
Sure.
make it dramatic. There, awesome.
Oh my gosh, the blood. And then you flush that back through.
And I pass out.
Oh, it's cold. All right, so I know that's a good drawback, so I know the nurse is gonna be able to draw blood if needed. And I know flush as well for me in case I need to put any medications or fluid to it. So I can take this piece off. And now I need to secure it. So Tristan, you're doing a great job keeping your arm still. I just wanted you to keep doing that.
Okay.
So I'm gonna place the Tegaderm over the catheter and the hub. And secure like this. And now this Tegaderm just peels off like so, and you just peel it off and you kind of secure all the anchors in. And remember I said each Tegaderm comes with a little piece of tape that the nurses really like, so I like to use that. And you secure it just like this, just over the end. And so that piece of tape, when it comes off, it doesn't really pull too hard, so it's easy to DC it or discontinue it. Now what I like to do with my tape is I like to break it into 2 halves, so it's a skinny piece, and it helps you to secure it so it's not too bulky. And so then we're just securing it in a spot where it's not going to obstruct the cannula itself and not going to bug the patient. We don't want to wrap it around the hand because you can cause some tourniquet type action and kind of restrict blood flow. And you just want to make sure it's not going to come undone.
You okay, Tristan? Nope. AJ, what happened here?
He got an IV in his hand and fainted.
So along with blood pressure, one thing we like to assess too is heart rate.
116 over 85. That's pretty good.
Right on.
I didn't do it on purpose. It's just it happened au natural.
We have to discontinue it because it's not working appropriately. So whether it's not flushing or maybe some redness or irritation or a hematoma forms, then you have to discontinue it. Or for example, if you're working in a hospital and your patient's being discharged, you can't send them home with an IV, so you have to take it out after they receive their treatment. So to do that, you just need to continue to work in a clean environment. So you have your PPE on, and you need some tape, which I have on the bottom of the stretcher here, and a 2x2, which is not expired, it's 2024. And some people like to use a Tegaderm as well instead of the tape. So whatever is clean, whatever you fancy, okay? Whenever you want to discontinue it, so Tristan, I'm going to take this IV out, okay?
Yep.
If you start to feel weak, just wiggle your toes and just stay put, if so, okay?
Yeah.
All right, so to take out the IV, we just like to remove it, starting outside and moving closer into the site itself. Okay, so I like to take the tape off in all parts. So tape is one of the trickier parts. You don't want to just take it and rip it and then have the IV actually come out. So I like to hold the pieces down while I take the tape off. Grab this and bring it close. All right. My 2x2 ready.
Oh, it's got the hairs in there.
Yeah.
Nice.
So remember to wiggle those toes of yours, Tristan.
That's a free waxing.
So I'm gonna pull all around the area. Very localized wax.
Oh,
You're doing good.
nice.
And as your pull get close to the area, I just like to put a little bit of pressure over the hub of the catheter. That way you won't accidentally pull it out. So what I like to do is just pull it back so that you can visualize the catheter insertion site itself. You don't have to take it all off. Keep good pressure there so you won't pull it out by accident. Take your 2x2 and place it over the site with some mild pressure. And then remove the catheter itself while keeping the 2x2 over. And once you remove it, you can place pressure, wiggle those toes. We're gonna pull it out.
Yep.
Just like that, and place it in the appropriate garbage bin. And then you can just hold pressure for 1 minute, 2 minutes. Patient can do that if you need help. And it's a vein, so it's a venous bleed. It's nice and slow. A minute of pressure, and then you put some tape on, and you should be okay.